So that's a good one because I didn't want to ask it on the main stage, but ever any sort of regret? Because we have Brian Chesky, who basically delayed his IPO, like not clear when they're going to go, and there are pros and cons of sort of going public. So, any thoughts?
Yeah, I mean, nothing's ever like peaches and cream and unicorns all the time. So I'd say going public, there are some good aspects and bad aspects that we considered at the time. For us, a lot of the value of the IPO was, as a financing event. I think this was probably in the earlier days of huge private rounds, but we still felt going public was really the only way for us to raise a lot of capital. And we ended up raising over $800 million in our IPO. I think it was the largest, it might still be the largest US consumer electronics IPO in history. So, and that's been great. I mean, it's allowed us to have a pretty healthy balance sheet and gives us a lot of flexibility in terms of operating the business. I think the downsides of being public are definitely if conditions or the environment change, it's definitely a lot more difficult to try to navigate or change path or turn around the company with a tremendous amount of public scrutiny. Whereas if you're private, for instance, your valuation doesn't change between rounds, right? So everyone can remain focused on the goal or task at hand. When you're public, you're being measured every day. And I think for people who aren't prepared for that type of scrutiny, it's tough.
Yeah, that was my advice to the SendGrid people who just went public. It's don't watch the freaking stock, every day because it doesn't matter, it doesn't mean anything. But they're not listening. Anyway, my personal point of view as a VC is that eventually the company has to get in the public eye and essentially grow up as an organization and get into sort of a more mature stage. So I think delaying all those sort of companies that raise hundreds of millions of dollars before going public, obviously it's kind of easy money for them, but they will sort of pay that price because at some point you need to sort of continue growing as a public company. So we'll just see. One question around Twine Health. So we sort of addressed that a little bit in our conversation. Do you want to add anything about how you're going to integrate it and market it?
Yeah, so Twine Health is a great step for us in building our healthcare business, and that's been a big focus of me and the rest of the team at FitBit over the past couple years. But there's no one silver bullet. Twine's one of a variety of pieces that we're trying to put together to execute on the strategy. But what I'm excited about for the acquisition is that it's allowing us to move beyond the device in terms of how we position ourselves with the healthcare industry. Twine brings us a lot of AI capability, data integration, and more importantly, human coaching as well. Because I think while there's a lot of talk and hype about AI and bots, etc., one of the biggest drivers of behavior change is actually still having a human in the mix, because people do feel more accountable to having a real person be alongside them in their health journey.
There's actually an interesting segue into a question, which is the social pressure and social element of exposing your data. And once a week or twice a week or sometimes every day, I check where I am in terms of the leaderboard and number of steps. And I have a friend at Google always beats me. That makes me angry. So how much have you seen sort of whether that helps performance or retention?
Yeah, it actually helps in both. So a couple of the stats that really stand out for me is every friend that you add increases the amount of activity you do every day. So every friend adds about 700 steps per day to your total. And obviously, it's not infinitely scalable. You can't add 10,000 friends and expect to be super healthy. I think it starts to plateau after a while. But we do see that the social element really helps people achieve and hit higher health goals, and actually keeps them using our device and service longer as well. So that's a big thing that we try to do, is that whole social experience.
Interesting question. We heard recently that Strava and a few other services sort of were displaying where military or Black Ops people were actually doing the exercise Have you guys sort of had those issues? Is this something that you shut off? What has been the last couple of weeks of work around privacy?
Yeah, so obviously there's responsibilities that we have as a public company in terms of disclosure. So nothing, So I think we've tried to take the appropriate measures. We have a pretty big security team. For a company our size, there's actually a great interview in the Wall Street Journal today that came out with our head of security about a lot of the things that we do to safeguard people's data. And from the very beginning, our revenue model has also been very clear. We don't sell ads. It's primarily the sale of devices and software and services. So I think the interests of our consumers and the company are very well aligned in terms of protecting people's privacy, and I think that served us pretty well. In the case of Strava, I think that was pretty unfortunate. I think it did have a lot of blowback on the whole industry, but I think people, whether it's, especially the military, are intelligent enough to discern, what was actually the root cause of the problem and, what companies are safe versus not, et cetera. So we continue to have pretty productive discussions with people in the government.
Question around retention. What have you guys? So obviously you've been trying a bunch of things over the years to sort of figure out what is the way to get people to keep this on their wrist. Have you sort of seen either key sort of techniques to increase the retention, or is there a number of days or weeks or months? If you sort of can get a user there, then they will sort of use the device for life.
Yeah, a lot of, so the first thing to realize is, people talk a lot about retention in this industry, and there's various news reports out there, 6 months is the average retention, how terrible that is. I think then people forget to realize, your typical gym membership or usage of home gym equipment is probably measured in weeks. Like the half-life on health and fitness retention it's a pretty harsh environment. I think we've been pretty successful in retaining people. We've shipped over 70 million devices. We still have 25 million active users accumulated over 11 years. So I think that speaks to testament of what we're doing. But typically what we see is that, there's a lot of drop off in the first week. And I think it's because there's usually a mismatch between, what people expect from the product or service and what it delivers. There's also a lot of, I think, excited aspirational intentions by someone, especially at New Year's, which can quickly fade away. There's a lot of product education that has to go along. So I think we look at that first week as a pretty critical time in terms of making the whole experience stick.
And what's the hook now? Is it still sort of steps activity? Is it sort of measuring sleep patterns? What's the driver?
It's starting to evolve. So I think in the early days, and people might consider steps to be synonymous with FitBit and vice versa. But I think what we're doing and what the whole industry is doing is becoming more multifunction and more versatile. So definitely heart rate is becoming much more important because people realize that every step is not the same. There's different effects to the amount of effort and intensity and frequency that you bring to it. And actually one of the things that we're doing with United Healthcare, the largest health plan in the US, is you get rewarded based on this metric called FIT, which was frequency, intensity, and duration, tenacity, duration. And that's actually resulted in research-backed positive health outcomes. So, and the other thing is around sleep too. There's a lot of growing interest in sleep, the quality of sleep, how much time you're spending in deep and REM versus just light. So I think the awareness of what this whole category of products to do will be increasing, and that's pretty exciting.
Yeah, no, as I said on stage, I'm fascinated by the sleep patterns and the benchmarks and how I've been doing over a 30-day period. That's really sort of worth it. Let's go into that question around, so we have a diabetic user who wants to sort of understand how we're going to be integrating with sort of sugar level sort of equipment and everything.
Yeah.
I was actually asking you the same question.
Yeah, so we're very actively involved in diabetes management. It's one of the key focuses of the company. It's one of the reasons we partnered with Dexcom. It's why we invested in a company called Sano. It's why we acquired Twine Health. So in particular, the Dexcom integration, that's in conjunction with United Healthcare. And how that partnership is going to work is that, tragically today, you think about, integrating data. A lot of data integration just doesn't happen or hasn't happened historically in the healthcare industry. It's been very siloed. So what we're trying to do with Dexcom is take real-time data streams from a Dexcom continuous glucose monitor, merge it with the activity stream from a FitBit, and what we're trying to do is that reduce the amount of insulin that people have to take. So what happens typically is if you ingest a lot of sugar, let's say you drink a can of Coke, which is highly not recommended, whether you're diabetic or whether you're healthy, you'll see your blood sugar from your Dexcom spike pretty much immediately. In fact, my co-founder has been wearing a Dexcom, and he drank a Coke, and literally it went vertical, the reading, and he got like scared. He got scared to death of it. He's gonna stop drinking any beverages with sugar right now. But and then if you don't do anything, your sugar readings will stay up pretty high for a long period of time. But what clinical research is starting to show that if you do a certain amount of activity, a certain amount after you drink or eat sugar, and at a certain intensity level, you can actually take your blood sugar levels down pretty rapidly, as opposed to just letting it sit there. And that can be a replacement for taking insulin. So we're almost thinking of exercise as a digital therapeutic in lieu of insulin, and that can not only result in better health for the diabetic, but also reduce healthcare savings because of lower medication costs for the entire healthcare system.
We actually have a startup we invested in, which is in the mental health space, and essentially the protocol, which is you use an iPhone app, and they sort of guide you towards, a certain sort of protocol, and it has the same efficiency as drugs.
Absolutely.
And so
yeah.
and you don't have the side effects and everything, so it's pretty amazing.
Yeah, mental health, yeah, absolutely. Exercise is a great substitute for antidepressants.
Talking about sort of trackers, so we have a question around incorporating hormonal tracking for menstrual cycle tracker, ovulation tracker. So how do you think about all those other sensors or data points that either you want to sort of integrate or that would be relevant to add to the mix to have sort of a holistic view?
Yeah, so heart rate is something we launched 2 or 3 years ago, and there's still a lot that we can do around heart rate. And what's one of the more interesting things is taking a look at all the historical data that we have and merging it with health records and also medical claims data to actually determine what are the targets for your heart rate, whether it's resting heart rate or amount of intense activity that you should be doing that result in better health. Mm-hmm. So I think there's a lot to be done in heart rate, even though the sensors are there today. The other really untapped opportunity is sleep. We launched a relative blood oxygen sensor in Ionic. It's, I think, the first of its kind in a mainstream wearable device, and that's going to allow us to diagnose sleep conditions like sleep apnea. Arrhythmia and AFib detection is another area of exploration that we're doing. We actually have a clinical study going on with MedStar Georgetown University. And then there's other things around detecting mental health, integrating sensors potentially like EKG, et cetera. So I think what's exciting about the next few years is that really these devices are moving beyond what people thought of as just step counters into truly multifunction, mission-critical healthcare devices.
So you now have, this is actually a third-party platform, right? You now have apps running on the Ionic.
Absolutely.
Do developers have access to the different sort of sensors? Is there like a protocol, security, validation? Like how does that work?
Yeah, so we acquired Pebble about a year ago, and one of the biggest things that Pebble was creating at the time was a JavaScript and SVG-based developer toolkit, mm-hmm. and we actually managed to launch that with Ionic. So with that platform and SDK, developers actually have full access to all the sensors, and there's a lot of apps that are in development that unlock the potential of them. Dexcom is going to be launching an app that integrates their CGM data. Twine Health, I think they just got their app running this morning, actually, with the timing of the acquisition. So I'm excited to see a lot of the things that the healthcare industry does with the developer platform.
So because this is critical data, there was a question around third-party access. There's obviously sort of HIPAA issues. So how do you guys sort of provide the functionality without the privacy issues being sort of not going through a DA, but you're without sort of disclosing patient data? So how do you sort of balance all that?
Yeah, so we became HIPAA compliant a couple years ago, I think. So that was something we did pretty early on because it's a key criteria in selling solutions to the healthcare industry. And our policy has always been that we're not going to be sharing data with third parties without their explicit opt-in consent. So that's another mechanism we have to protect users' data. And we will never be selling data with third parties or even sharing data with your employers without those principles in place.
Mm-hmm. Have you had sort of pushback from sort of privacy organizations, or because it's always this sort of fine balance between progress and privacy. So have you sort of worked with privacy organizations on that, or?
Yeah, I think we've worked pretty closely from the early days, and also with the right government agencies as well. We have a continuous dialogue with the right people in DC, and for us, we feel that, again, our interests and the interests of our consumers are very well aligned. And for me personally, having my data on FitBit, I totally want it to be safe and secure, et cetera, and protected in the right ways. And I think we've done a pretty good job over the past 11 years building trust with users.
So we tried to, in the second part of our conversation, we tried to go into a bit of entrepreneurship, sort of your journey, advice, and so forth. So we're going to continue that. So we have a few things. One is sort of the key qualities of an entrepreneur. So we have one question about teen youth entrepreneurs, but I think that sort of is valid for any age of entrepreneur. So what do you think are the main drivers that got you there in terms of key characteristics, and what do you say you should sort of, not you should have changed, but if you were to change one thing going back in time, what would it be? So key characteristics of entrepreneurs, and then 11 years into it, what would you have done differently?
Yeah, so I think one, it starts off with your motivation, like why are you starting your company and what's going to drive you every day, and it can't purely be about money. I think if that's the only reason, that's the worst reason. Obviously, that's a component of entrepreneurship, but you really have to be driven passionately about your mission, your vision, and the benefits you're providing to society as a whole. That's what sustained me, and is sustaining me over the past 11 years. I'm excited to come into work every day because I genuinely believe we're really helping people with what we're doing, and that also attracts a lot of great people to FitBit and to work with us. So I think the motivation is really the foundational aspect. And then beyond that, you're obviously going to hear a lot of no's, so I think persistence is definitely a key attribute. I remember during fundraising, we'd have that shared Google Doc with list of all the target VCs, and then have like red, green, yellow for each of them, and then they go from green to yellow to red, and then it'd be like red all the way down, and then it'd be the last one that would be green, right? You only need one. And I think a key quality is that, not coming away from every meeting and going, they don't get it. I think that's the worst attitude you can have coming out of a pitch meeting. Sometimes maybe that's true, but there's always something to learn from every meeting, and every pitch that we had, we made the next one better and better and better. And I think that's ultimately what led us to getting that, final person to say yes.
Yep.
So that was key. And I think the third thing is just resilience, which is somewhat related to persistence. There's going to be a lot of dark days in the company, and I can't even count. I think Brad Feld, who is also an investor in the company, there was one moment in time when we had a product recall, and I was in, we had board meetings literally every day trying to manage the company through it. But the first time I notified the board, Brad told me afterwards that he had to go to the bathroom and was literally almost sick. And I felt the same way as well. So there's always a lot of those nausea-inducing events in the company's history, and you just have to power through it, through whatever it means.
Even the amount of shit that Brad had to go through in his career, that's actually pretty tough.
I was pretty surprised. And I also don't drink that much, but I also remember the first time we got sued by a patent troll. I thought, oh my God, this is a life and death event. Like, what are we going to do? How are we going to manage through this? And I remember going home and having a glass of wine just to cool my nerves, which is a really rare event. And now getting sued by patent trolls is just
par for the course.
Trolls sue us, and I'm like, move on to the next issue, and our general counsel and our legal department just handles it. So.
Yeah, and because it's the U.S., you can be sued for anything and everything. I remember we got even sort of mentioned that some kind of a bullshit sort of lawsuit, and they all sort of went away.
Yeah, I think we've gotten sued for literally every possible thing you can. I testified at a federal trial, which was kind of an interesting experience, not recommended. We won that case, but just, there's a lot of things. You see a lot of aspects of entrepreneurship, the bigger and bigger you get, and you learn from it. The first time it always seems like a crisis. The second time it's just, hey, it's just the course of doing business.
And so that's really interesting, because that's something I would have said slightly differently, but those are the key characteristics that we look for in terms of entrepreneurs. One of the key questions I like to ask is, what's your story? And it wraps, both the motivation, the, how you came about with this concept, this service that you want to try and develop. And we want to try and assess, this, what I call the walk through walls attitude, which is, there's going to be like so many times where you're going to have this massive wall in front of you, and there's just no way around. You just have to punch through it. And for entrepreneurs, trying to assess that and how committed you are to this is really important, because it's hard. It's really hard. And if you're successful, you're going to spend a good chunk of your lifetime on it, like 11 years. So think about it. And if you think that being entrepreneurs because it's cool, it may be cool, but it's not the reason that will sort of get you to wake up every morning. Let's see, what do we have? Let's go into the challenges in hardware development. So we sort of touched upon that a little bit. So I think we died almost like 7 times because of, well, you mentioned that to me, so I'm not sure whether this is the number, but we had a number of issues with hardware development. Is there anything today that makes it easier, or is it sort of the same trial and error? Because it's really sort of seems, it all goes well until something sort of drops, right? And then you fix it and then you continue.
Yeah. I mean, I'm always surprised that, because I talk to a lot of hardware startups, and you do as well. I'm always surprised, like, okay, people get experience, there's a lot more expertise around the industry. Things should get easier at times in product development. But I'm always surprised at all the different ways hardware projects can go on. Like, there's always something new, and I'm like, hey, that's new. That's crazy. Even internally, there's always some new thing that we haven't anticipated. And so I think it's always about having a plan B or C or D that you can roll to. So in the early days of FitBit, I think one of the scariest things is we'd have, let's say, mechanical design, and we'd only have a plan A. Plan A didn't work out. I don't know, it might be a 3-4 month delay. And you couldn't have a plan B because it costs money to have a plan B. And I remember in the early days, I think this was pretty close to, let's say we're trying to finally get our launch after all these delays. And I was in the production line, we're testing the first few units off the line, and the radio range on the first units was like literally like several inches, which is, short of our 20-foot goal at the time. And I literally felt like dying. And we ended up solving the problem. I realized that the cable on our display was getting too close to the antenna, and that just wasn't something that had been modeled or was apparent in the CAD. So what I did in our hotel room was, let me see if this is actually a problem. I took like a little wad of toilet paper and shoved it between the antenna and the display cable, and it started working with me. So the next day we went to the factory and said, hey, I think I found what the problem was, but obviously toilet paper wasn't a scalable solution in manufacturing. So they came up with, coming up with buying huge sheets of foam and then, cutting them up and gluing them to the circuit board to have that basically shim. Now what we'd have done is, there's like, okay, if that didn't work, we'd have a plan B design, a plan C design that had already been developed in parallel, and then we just fall back to one of those. But that costs money, but if I had more capital back then, that's definitely something we would have done differently.
I think that's why if ever you're tempted to do a hardware startup, you really want to have someone who's a tinkerer who has done sort of hardware in the past on your team. Otherwise, you can't just outsource. There was a question around outsourcing. There is so much you can. I mean, there's a lot of things you can outsource, but not having sort of this deep knowledge, understanding of what it takes to actually get a successful hardware product to market is something that we will look at in the team. And if you don't have that, that will be an issue because it never ever works as planned. There are so many, and in my experience, and we've done whatever, 12, 13 hardware investments now, it always cruises until there's some shit happening. And it's either your design, it's either your manufacturing partner, or some dude who was supposed to give you a component that looked like this, and like remember when someone gave you a battery which was slightly too long and you had to get everything sort of showed away.
And even today, like one of the challenges facing the industry is the supply of capacitors. What's happened over the past year or two is that the auto industry, with all these sensors, has been sucking up more and more of the global supply of capacitors. Not something that could have been anticipated by some of these suppliers in planning their production capacity, but it's sending lead times out to 70 plus weeks. So things like this just happen randomly all the time, and you just have to work your way around it.
Yeah. So I think we're out of time. So thank you so much for joining us. It was great to have this sort of conversation. Kind of a bit awkward to look at a monitor as opposed to talking to you guys, but at least hopefully we got through a bunch of interesting questions. So enjoy the rest of the day, and we'll see whether we see you back in 5 years. Thank you.